I'm Meg Heaton, and welcome to Western Wisconsin Journal. I'm pleased to have as my guest today the Hudson Police Chief, Geoff Willems. He and I go way back. I did his first interview when he came to the North Hudson Police Department many, many years ago, and have watched him rise through the ranks to become the Chief of Police in Hudson. Over the years, we did a lot of stories together, and I always appreciated his willingness to work with me to keep the community informed. And this COVID-19 crisis is no different. I'd like to welcome him and ask about what the impact has been on the police department. Welcome, Geoff.
Thank you. Well, the impact of this COVID-19 response has been interesting. We've implemented an emergency shift. So basically we've segregated our officers and our shifts so that the same group of people don't interact with other groups of people within the department. So that's been a little bit challenging, although it seems to be working well. We've also worked into that schedule kind of a 12-day off period with some on-call time at home into that schedule, so that if someone did have an exposure or got sick, you have almost 2 weeks built in where you could determine whether or not you were going to become symptomatic or have to get tested or follow different quarantining rules, depending on what the advice is from the Department of Public Health. So that's one of the ways that it's impacted us. We've had to change the way we deal with people, right? We're putting our masks on when we're dealing with people in the public, just because we don't know. We don't know who we're coming across, if they're symptomatic, if they're contagious. There's just a lot of other things that we have to think about when we're dealing with people now that you never really have to think about before.
So in terms of like your average traffic stop, how does that work?
Well, it works essentially the same way, only the officer might approach you with a mask on. maybe have some gloves on, right? But it's a way to try and protect ourselves so that we can continue to try and protect the rest of the community. Because if we lose a third of our police department to illness, we're going to be hurting. We're not going to be able to fill shifts. We're not going to be able to have officers out there and ready to respond to emergency situations.
How many officers are on staff now?
We have 28 sworn.
Okay, so that's up since I left in 2017. So
yeah, it's up like about three or four since then.
Yeah. Does that feel like enough to you?
For now, it is. We're right around the national and state recommendations for officers per 1,000 people. So as the community continues to grow, then we're going to need to continue to grow with it. But for right now, we're doing pretty good.
In terms of the day-to-day operations for the department, have you noticed any difference that the staying at home has had, like say on domestic violence calls or other crimes that you deal with?
Sure, not as much initially. I think people were kind of taking the extra time off away from work and getting home projects done and spending time with family and enjoying it. Kind of like a little mini vacation. But as we continue to go further and further into this lockdown period, people's nerves are starting to wear on them. I think there's a high population of people that are worried about finances. The stimulus only lasts so long. It's not like it's a bi-weekly stimulus. So I think it's starting to wear on people's mental health. And their ability to cope with the different things that are going on. The longer that we go into this lockdown period, we can see it kind of ramp up a little bit with the types of calls that we get and the type of people that we have to be dealing with.
And your guys are especially, I mean, they've undergone a lot of training in helping to diffuse those types of situations too, haven't they?
Yeah, absolutely. Most of my department is critical incident certified, so they're trained in talking people down when they're having a moment of crisis, a crisis intervention. So we're trained in that. We're experienced in that. I mean, Meg, that we wear many different hats in what we do, and that's just one of them.
Yeah.
But we're definitely honing our skills in that capacity during this situation.
Because I would imagine people are kind of looking to you. I mean, there's a sense of security of seeing our officers around, and that kind of role that you do play is a critical one from my experience.
Right. And, part of that too is we're trying to encourage our officers to be out there and be visible and not sitting in the police department with the other guys that they're working with for obvious reasons. Right? We still want to be visible in the community. We still want the community to understand that we're there for them and that we're ready. And then also the other side of that is to protect ourselves so that as best we can, so that, we don't contaminate the entire police department.
Yeah. How about with juveniles? I keep seeing every once in a while, I'll see a group of kids and they're certainly not 6 feet apart, but they're kind of trying to be sneaky about it, I think sometimes. How about a juvenile issues?
Yeah, well, it's not just juveniles. There's plenty of adults that are acting in a similar fashion. And, you understand it, but at the same time, it's one of those balancing acts where you have to try and determine, how you're gonna deal with that. And usually it's just rolling the window down. Hey guys, make sure we're staying 6 feet apart. Let's remember social distancing or something like that. Juvenile issues, yeah, I mean, they're not at school, right? Even though they're doing the online learning, it's only taking most kids 2-3 hours a day to complete their lessons for the day. And if parents nowadays are anything like my parents or me as a parent, it's like, get outside and go do something. So yeah, there's a lot more juveniles out and about, and they're trying to be active and trying to be safe and trying to stay out of mom and dad's hair. And it's challenging. It's challenging for everybody, and we understand that.
How is it for you in terms of how many kids do you have?
Just one.
Just one. And how old?
13.
And 13. Oh, that's a good age. So how are you handling, health science class and all that stuff?
He's doing pretty good. He's in the age now, an 8th grader going into a freshman, that his teachers just basically give out the assignments and I don't have to do a whole lot of home instruction. So that's good because math would not be good for me.
That was not my strong suit either. One of the things that I was thinking about in preparation for this is that you probably were instrumental in giving me the biggest story of my 27 years at the paper when you and it was you and Chief Marty Jensen who contacted me and said, we need to do something to get the public aware of the impact of heroin and opioids on the community. At that point in 2013, I can't believe it's 7 years ago, but it was responsible for multiple deaths and overdoses. We were losing young people at a terrible rate. I think there were 7 deaths in 2 years. And you guys were the ones who contacted me and said, we want you to do a story about this. Where do we stand now in terms of the impact of drugs and opioids in the community?
The impact of drugs overall is unchanged. I think they're going to different drugs. Methamphetamine is still, by and large, the drug of choice with marijuana. A lot of the educational efforts that we did with you and with your partnership and with all the other partnerships that we forged during that time, I think, weighed very heavily on the success that we've seen with the decline in overdose deaths. It got into the clinics and the doctor's offices, and they started to become more cautious about prescribing the OxyContins and the other narcotic drugs of the world for pain compliance. It all helped, right? The education, the change in policies, the change in practices, the availability of Narcan has saved, I can't even remember, countless numbers of lives in the last 5 years just here at the Hudson Police Department. The number of people that we've used Narcan on that were in an active overdose situation. So the problem still exists. You still have the certain population that is going to abuse drugs of all kinds, no matter what. And it's how we're going to respond to that to try and benefit the community the best we can and to try and protect our community and get them the resources that they need after the fact is what we're trying to focus on.
One of the other things that you guys were so involved in, and I think to the point where the public didn't realize, was in the mental health crisis situations where we didn't have good mental health facilities around here, and sometimes you'd have to send 2 officers across the state all the way over to Green Bay area or wherever to take people who are having a mental health crisis. Is that improved at all?
No, but it's still the same. We still don't have any extra beds in this region. I know there was a proposal to add 21 or 27 beds in the Eau Claire area for us to have closer access, but the only state hospital that is within our reach right now is still Winnebago, which is in Oshkosh, and we're still making multiple trips a year. Just did 2 trips to Winnebago last week. So,
and you're not able to use facilities in the Twin Cities, right?
No, because of a contract issue across state lines.
Yeah. And
so that's problematic for us. And until something changes on the side of the legislature, which is a very difficult thing to do, it's going to be unchanged until we fix the system overall.
Right. And those situations, the incidents, I imagine, have ticked up as well over the years of you being involved in those kinds of calls.
Well, especially in the last 6 weeks that we've been in this COVID crisis. People are isolated more. You can't stop and check on people. You can't see your friends. You can't see your family. It's very difficult for someone that's already susceptible to crisis to isolate them to themselves and expect that crisis to reverse itself. So we have seen an uptick in mental health type calls and complaints. Yeah. And, quite frankly, I think that's probably going to get a little bit worse before it gets better. And it's not going to get better until we start opening up the quarantine lockdowns.
Yeah. Do you have any sense of how long the lockdown might last?
I don't. I see the various reports and I see the guidance from the federal government and the statement from the state that they're going to try and follow the guidance from the federal government. And the big thing seems to be the testing capacity and the 14-day period of a downward trend of new cases, or the percentage of new cases as far as the testing goes, right? I don't know, quite frankly, where we're at. I think we're 5, 6, maybe 7 days in a downward trend in the state. So we'll see, I guess. I don't have a sense. We're just kind of in a holding pattern and waiting for guidance from the state. And when they start opening things up, then we can kind of change some of our practices and respond to it. But until then, we're just kind of following what the state is recommending that we do.
Do you have access to testing for your guys in the event that you would need it or they would be exposed?
Yeah, so our team, as well as firefighters, EMS, medical professionals, are all in the tier 1 of the testing category. So if you get exposed to someone who had a positive confirmed test, you're going to get tested. If you come down with symptoms, you're going to get tested. So that's good to know, but you could be contagious for several days before you even become symptomatic. So it's still a guess, as far as what you have, if you have anything. But we do have the capability, and now with statewide, the testing availability is ramped up quite significantly from what it started even 3-4 weeks ago. So I'm optimistic that we're going to see the end of the physical lockdowns to this level in the coming weeks.
Sure. Is there anything else I haven't asked you about that you want to mention, or any other issues in the community that maybe people don't realize?
I guess the only thing I would say is that I know it's tough, and I know it's a struggle for people out there to not be able to go out to their favorite restaurants and to go and see their best friends and hang out with their neighbors and everything like that. But we're trying to do this stuff for a reason, to protect everybody. And the only way we can do that is try to follow the rules the best we can, follow the guidance from the Department of Public Health, follow the guidance from the state public health, and just kind of plug along. This too shall pass, and we're not going to do this by ourselves. We have to stick together.
Absolutely. And has it meant that there's been less burglaries and all that kind of stuff, or no such luck there?
There actually has been a little bit of a downward trend in some of those type property crimes. Yeah, because people are home, right?
Yeah, they're there.
So there is some good with this as well.
Yeah, that's true. Although businesses are locked, I suppose but
Businesses
now
are
some
locked.
businesses can open again, right?
So
Eventually.
we're hopeful that things can start to slowly get back to normal here in the coming weeks.
Well, thank you very much, Chief. It's good to see you again. And I know you and your people always do a terrific job for the community. So thanks again and stay safe.
Thank you. You too.
All righty.